Hello to all of the audience. In this next occasion, we are from SGD number B1. Would like to present our student project entitled Elderly Traveler. But before we do presentation, let me introduce the members of SGD number B1, which shown in the slides. And for the next speakers, the time is yours.
Thank you. My name is Gede Pramaditya Wahyu Saputra and the last three digits of my student numbers are 045. In this occasion, I would like to present the chapter 1 of this paper, Introduction. The first one is the background. In an age where the world has become more accessible to transport from one place to another and the need to travel is increasing, international travel has become a trend nowadays. One of the traveler is the elderly, and the elderly are the ones that require more attention and resistance in traveling to ensure their health, well-being, and safety. Concerns about the health of the elderly individuals during traveling are essential for several reasons. Traveling involves new exposure to new environments, climates, and altitudes. Hence, one of the most important things to note is that elderly need more time to adjust because of their vulnerability. Many diseases related to traveling are pulmonary embolism, pulmonary edema, severe malaria, diarrhea, urinary tract infection, and heart disease. These medical conditions should be noted so that elderly can travel freely. The second one is a problem formulation. Based on the introduction, the problem formulation that the writers will discuss in the student projects as follows. First, who are considered to be elderly travelers? Second, how is the pathophysiology of the elderly? Third, what are the precautions before traveling? Fourth, what are the most common medical conditions in elderly travelers? The third thing that we will discuss is the objectives, divided into two. The first one is general objectives. The general objectives of this student project is to explain what things that have to be concerned when the elderly travel and what medical conditions that often happen in elderly during travel. And the specific objectives are first, to explain the definitions of elderly traveler, second, to explain the pathophysiology of elderly traveler, and third, to explain the most common disease and problem in elderly traveler, such as motion sickness, jet lag, hypothermia, hyperthermia, cardiopulmonary disease, respiratory disease, DVT, diabetes mellitus, osteoarticular disease, dementia, and constipation. Now, the benefits of this paper. From the process of building this student project, the writers realized that there are several benefits of this student project, which are: the first one is the authors are expected to add insight to elderly travelers, including the most common medical condition in elderly during travel and how to prevent and treat them. The second one is for other authors. It is hoped that this student project can be a reference for further studies regarding more in-depth matters regarding an elderly traveler. That's all from me. The next presentation will be continued by my friend. Thank you.
Okay, so hello everyone, my name is Feroza Husni Adiba with real last digit of student number 102. So I'm gonna explain about the definitions of elderly traveler. So traveler in general can be defined as someone that is willingly to travel from one geographical location to another for any purpose within any period of time. By these definitions, elderly is a group of people aged above 65, referring to those that are already retired. But many researchers find that this term is interchangeable with senior traveler, that indicates for people above 55. And according to a travel insurance called Square Mouth Company, elderly traveler accounted for 37% of all travelers in 2023. Think that's all from me. Thank you very much.
Hello everyone, my name is Asikirana with Trila student number 087, and now I would like to explain about the pathophysiology of the elderly. When traveling, elderly travelers frequently face difficulties or needs extra time to adapt to their environment. Aging-related vision and hearing loss makes it more difficult for elderly travelers to notice signs and hearing warnings in crowded areas, which can cause confusion or anxiety. Age-related structural changes in the lungs include a decrease in alveolar function and lung elasticity, which lowers adaptive capacity in hypoxic situations, like at high altitudes. Elderly people's decreased thirst sensation and age-related decline in kidney function make them more susceptible to acute renal failure and dehydration. Thickening and stiffening of the arteries are more likely to occur with age. In elderly travelers, this problem may worsen due to the rise in blood pressure that occurs as a cardiovascular adaptation response to exposure to high altitude, which may result in serious complications. As people age, the innate and adaptive immune systems undergo several changes that lead to increased susceptibility to infection, a decreased response to immunization, and a rise in the incidence of certain autoimmune disorders. I think that's all from me. Thank you.
My name is Nyoman Gede Wiragunarti Paramarta, and the list number is 180, and I'm going to explain about the elderly traveler and flights. So, elderly tourists have special consideration for their health on every trip they take. Careful planning is essential to ensure a safe and comfortable flight. Before making any travel plans, it is important to obtain medical clearance from your healthcare provider, especially if you suffer from a chronic illness or have recently had surgery. Providing airlines with information in advance about specific medical needs is critical, enabling them to provide appropriate accommodation and services. Medication should be managed carefully, with enough supplies for the entire trip, and carrying a medical information card can help with quick referral during an emergency. Those who require medical equipment such as a CPAP machine or oxygen concentrator, early communication with the airline is necessary to ensure proper arrangement. Throughout the journey, maintaining open communication with healthcare professionals and airline staff will contribute to a smoother and safer travel experience for seniors with medical problems. So that's all from me. Thank you.
Hello, my name is Jenaka Pramesti with the last three digits number 208. So now I'm going to explain about the medical condition during travel in elderly, especially motion sickness. So motion sickness is a complex illness that develops as a result of actual movement that occurs while traveling by air, sea, or land, as well as while riding in a car or train. The most common symptoms of motion sickness is nausea. So adults over the age of 50 are less vulnerable to motion sickness due to loss in vestibular function by age. Prevention of motion sickness are by looking outside the vehicle, stay hydrated using a headrest, and sit in a stable position. Anticholinergic drugs, scopolamine, are common use drug to treat motion sickness, but may have harmful effect in elderly, such as drowsiness, dry mouth, and impaired vision. However, scopolamine is one of the most effective oral medication for motion sickness. And other drugs that used to treat motion sickness are such as dimenhydrinate, diphenhydramine, and also similar antihistamine. So that's all from me. Thank you.
Hello, my name is Komal Sribungasdani with the last three digit of student number is 241. I will explain the jet lag and time zone in elderly traveler. Jet lag is the disruption of circadian rhythms that occur when traveling across different time and zone. The duration of jet lag depends on the number of the time zone crossed. When traveling, it is important to consider the direction of flight as it is related to time zone. Flying eastbound may result in more severe jet lag than flying westbound over the same distance. The direction of the flight also plays a role in the experience of jet lag response. When flying west, you tend to experience sleepiness at night and wake up in the early hours of the morning. When flying east, the body may experience drowsiness in the morning or afternoon. The common signs and symptoms of jet lag include fatigue throughout the day, disrupted sleep, headache, impaired cognitive function, reduced appetite, lack of coordination, gastrointestinal disturbance, and many more. Jet lag in elderly not only disrupt their sleep patterns but can also lead to confusion about medication timing due to restricted mobility commonly observed in the elderly requires the presence of caregiver. Elderly travelers should plan their trips in advance. Not only the tourist destination considered, but the physical condition of the elderly is also important. During the trip, it is important to ensure adequate rest and hydration to keep the body fit. If the trip is lengthy, it can be divided into segments by making a stopover. This has been shown to minimize the symptom of jet lag. That's all for me, thank you.
Last digit number of student ID is 002. I will explain about the hyperthermia and hypothermia on elderly traveler. The first one is hyperthermia. Aging impairs peripheral vasodilation and decreases sweating, which lessens the body's ability to cool itself in hot weather. Due to the fact that alcohol and caffeine exacerbate dehydration, older travelers should exercise caution when traveling in hot weather and make sure they drink enough water. And the second one is hypothermia. The consequences of cold are considerably more severe in elderly. Shivering or the production of heat is less common among the elderly. Layering garments appropriately is important, and wet clothes should be replaced right away. The risk of cold-related ailments, such as hypothermia and frostbite, can be alleviated by alcohol use and tobacco use. Maintain enough hydration is crucial in both hot and cold water. That's all for me. Thank you. Next slide, please. The first one is hypertension. During flight, the barometric pressure drops. This drop in arterial oxygen tension tolerated in healthy people, but may cause ischemic and arrhythmia in vulnerable patients. Listening to the pressure change, individuals who have hypertension could need more oxygen during travel. That's all for me. Thank you. The second is syncope. For individuals over 80 years, the yearly incidence of syncope reaches 2%. The prevalence rises with age. Initial steps in managing including positioning followed by airway, breathing, and circulation for resuscitation. This intervention needs to be close coordination with ground control to determine decision for flight diversion. Interventions which have been tried for prevention include mental challenge and increased salt and fluid intake. That's all for me. Thank you.
Hello everyone, my name is Yunus Nadia with my last unit number 160 and I'll explain about dehydration. So dehydration is actually quite common on elderly due to the effect from several factors like falls, diabetes, renal illness, immobility, and reduced stress mechanism. Dehydration can occur from cell production if the body's water deficiencies are not sufficiently restored. Reduced flow due to dehydration might worsen cardiovascular strain and cause acute renal damage and failure. So the treatment for dehydration will be eosinophilics and adequate fluid intake, and we would recommend to avoid caffeinated and alcoholic drink on flights because it could increase the diuretic activity. The next one would be cardiopulmonary disease. So when aircraft fly about 5,000 feet above sea level, oxygen inside the cabin will decrease and they may lead to some cases of dyspnea on older passengers, and hypoxemia or heart ischemia may be more severe with those with underlying conditions. So in a condition like this, a person in an accident could alert the flight attendant as soon as possible, where supplemental oxygen will probably be offered since some aircraft provide them. There are persons who are permitted to fly, such as a person having an acute decompensated heart failure or cyanotic heart disease, and a person with uncontrollable hypertension. And so we have recommendation too for elderly passengers who want to travel by plane. We will recommend to have an oxygen preparation before flights to avoid any unwanted accident.
Okay, thank you for the time. My name is Yuda, and I will explain for the next topic, which is respiratory disease or respiratory infection in elderly. Respiratory infections are a major cause of mortality globally, primarily impacting individuals aged 65 and above due to the severity of disease they endure. Outbreaks and global outbreaks of the influenza virus also emphasize age as a critical determinant for severe infections. Pneumonia is associated with many physiological changes that occur in older individuals, which increase their chance of developing the condition. Okay, for the next one, I will explain about the deep vein thrombosis or DVT. DVT is a condition characterized by the obstruction of blood flow in the deep veins due to a malfunctioning venous reflux mechanism. Regular travel often entails prolonged periods of inactivity, which might increase the likelihood of developing the deep vein thrombosis. An age-related factor that frequently contributes to the risk of DVT is advanced age. The aging process leads to physiological alterations in the hemostatic system, including elevated levels of procoagulant factors. Okay, that's all from me. For the next speakers, the time is yours.
I am Gusti Agung Krisaniama Putri with the last 3 digits of my student number R143. Will continue with diabetes mellitus and osteoarticular disease. So diabetes mellitus or DM is one of the metabolic disease that is characterized by the elevation of blood glucose levels. For elderly patients, type 2 diabetes mellitus or T2DM is more common due to prolonged exposure to dietary and lifestyles that lead to hyperglycemia. Globally, 1 in 11 individuals between 20 and 79 years old had DM. The highest prevalence of T2DM with approximately 25% is the patient over 65 years old. Elderly travelers are prone to do passive activities such as reading, sightseeing, talking, and eating. Therefore, the clinicians have to give the patient pre-travel consultation about individual's training and education for DM management. DM patients should have managed and pay attention to their diet intakes, especially caloric restriction and carbohydrate intake. Patients also have to do regular exercise and screening, especially to monitor their glucose level independently. Long-term management, insulin administration, and specific drug intake like metformin are vital interventions to prevent complications. Next, I will continue with explaining about osteoarticular disease. Osteoarticular and rheumatic disease may be categorized as rheumatoid arthritis or RA, osteoarthritis OA, and osteoporosis. The most common arthritis that also lead to impairment in physical abilities and autonomy is osteoarthritis. OA commonly develops in aging, obese, female, and joint injury patients. 1 in 3 individuals over 65 years old is an OA patient. As the 11th most debilitating disease, there are 43 million patients that suffer moderate to severe disability due to OA. While traveling, elderly patients will do a lot of active and passive activities in complex schedule. In pre-travel consultation, clinicians should give explanations so that the patient will keep their compliance to the therapy, know the emergency management and interventions, and know the expectation for the future activities. The comprehensive management that is needed to maintain our OA patients should improve their strength by daily exercise, avoid activities that overload or exacerbate joint pain, weight loss with a healthy diet and lifestyle, and also on letting their joints by occupational therapy. Other than those, oral NSAIDs or acetaminophen intake can be used as a pharmacological therapy of OA. That's all for me. Thank you.
Hello, my name is Mario Adrian, and I will be talking about dementia diseases in travels. Dementia is a syndrome characterized by a variety of cognitive impairment brought by neurodegenerative diseases or traumatic brain injury. Some people believe that traveling for those with dementia can make their quality of life better and psychologically healthy. But in some cases, the destination choices, caregivers, and information needed to find the travel must be complete as possible and chosen carefully since one choice can affect the patient. Constipation. Functional constipation affects a lot of elderly person. To make sure they feel comfortable to travel, they must make sure to choose foods and body positions that would help them feel comfortable and not hurting themselves.
Hello everyone, my name is Rafa Diaradra Fajri with my last 3 digits of my serial number is 244. Okay, so now chapter 3 conclusion. The term elderly traveler generally encompasses individuals aged 65 and above, sometimes including those 55 or older. Aging brings physiological changes that impact bodily function, making adaptation to new environments challenging for elderly travelers. Vision and hearing loss, reduced organ function, and immune system changes are common issues. Health considerations for elderly travelers are crucial, especially for those with medical condition, motion sickness, health consideration during flights, jet lag, temperature-related condition like hypothermia and hyperthermia, and chronic disease like hypertension, diabetes, and respiratory issues are significant concerns. Careful planning, medical clearance, and appropriate clothing are essential for safe travel for elderly individuals, particularly those with chronic illness or recent surgeries. Maybe that's all from me. Thank you.
Okay, that's all from us. Thank you for watching our video, and we would like apologize if there are any mistakes in our video. Thank you.